Hello and welcome to today's CPC exam preparation class. In this session, we are going to talk about an important topic that is frequently tested on the CPC exam, that fraud, waste, abuse in medical coding. Okay, understanding these concepts is not just crucial for passing your exam but also for ensuring ethical coding practices in your career as a certified professional coder. Okay. Agenda for this session is, here we are going to know given topics. We'll see about the fraud and example for fraud, and we'll see about abuse and example for abuse, and waste and example for waste, and we'll see some preventing fraud, waste and abuse things, and some CPC tips for fraud, waste, abuse. Okay, let's start with the fraud. Fraud in medical coding, fraud refers to the intentional deception or misrepresentation that someone makes to obtain an unauthorized benefit or payment. Okay, it is intentional deception or misrepresentation. It means they are doing knowingly. By knowing themselves, they are committing to do this type of practices to get the unauthorized benefit or payment. So this is a serious violation and can result in legal consequences, hefty fines and even imprisonment. So let's see some example for fraud. First one is upcoding. What is upcoding? Assigning a higher level code than what was actually performed to receive higher reimbursement. Upcoding means to receive a higher reimbursement, they are giving high level codes than what was actually performed. They performed one service and they are giving high level for that to get the more payment. So this is called upcoding. And next is billing for services not rendered. What is mean by not rendered? It means they not provided. Billing for services not rendered means they are billing for the services which are not performed. Claiming reimbursement for procedures or tests that were never actually performed. So this is comes under fraud. And another example, falsifying patient records. What is falsify patient records? Manipulating the medical records to justify unnecessary treatments. Manipulation is going to happen here, and this is also comes under fraud. Okay, so upcoding also comes under fraud. Billing for services not rendered also comes under fraud. Falsifying patient records also comes under fraud. Okay, so on the CPC exam, you may encounter scenarios based questions where you will need to identify fraudulent behavior. Always remember, if there is intent deception, it's considered as fraud. Okay, by knowingly they are committing to do this thing. By knowingly if they are doing, that is comes under fraud, and there is a serious violation will occur and results in legal consequences, hefty fines and even imprisonment. Okay, and example for the fraud: upcoding, billing for services not rendered, falsifying patient records. Okay, so next we'll talk about abuse. Abuse doesn't involve the same intent as fraud. It still leads to improper practices and unnecessary cost to the healthcare system. So abuse occurs when actions result in payments for services that are not medically necessary, fail to meet professional standards, or are overpriced. So when it will occur abuse, when actions result in payment for services that are not medically necessary, fail to meet professional standards, or are overpriced. Okay, here in fraud we see intentional deception, but in abuse there may not be intentional deception, but improper practices leads to unnecessary cost to the healthcare system. Okay, that result in payment for services that are not medically necessary, fail to meet professional standards, or are overpriced ordered. Okay, so let's see some examples for abuse. So billing for services that aren't medically necessary. So performing or charging for treatments that a patient doesn't need comes under abuse. Okay, there is no medical necessity for that service, but they are performing or charging for that treatment, that is comes under abuse. And next example, unbundling. Unbundling, here billing procedures separately that should be grouped together under a single code. So any two or three services comes under single code, but here what they are doing, or knowingly or due to knowledge gap also, they are coding that services separately. So when billing for separately, definitely cost will increase, but reimbursement will come more. Okay, that leads to abuse here. Okay, unbundled procedures, they are coding separately to get the more payment, comes under abuse. And next example, misusing the modifiers. Using modifiers like any modifier 25, 59, 26, any modifier, they are using improperly to increase the reimbursement. So using modifiers improperly to increase the reimbursement comes under abuse. Okay, the key difference between fraud and abuse is the lack of intent to deceive. In fraud we see intent to deceive, and in abuse there is no intent to deceive. However, both have severe consequences. Fraud and abuse have severe consequences, and you need to recognize these actions in the context of coding. Okay, so let's see about the waste. Waste refers to the overutilization of services or using resources inefficiently, which results in unnecessary cost to the healthcare system. See again, waste refers to the overutilization of services or using resources inefficiently, which results in unnecessary cost to the healthcare system. Let's see some example for waste. Over ordering diagnostic tests and performing unnecessary services. So over ordering diagnostic tests means what? Ordering excessive or duplicate tests when they are not necessary for patient care. Okay, they are ordering more tests or duplicate tests when they are not necessary for the patient care. And another example, performing unnecessary services, providing treatments or procedures that do not provide any clinical benefit to the patient. Okay, providing treatments or procedures that do not provide any clinical benefit to the patient. Okay, these are the example for waste. So waste might not be intentional, but it can lead to increased healthcare costs, poor patient outcomes, and misuse of medical resources. On the CPC exam, you may be asked to identify scenarios where wasteful practices occur. Okay, So let's talk about preventing these situations, preventing fraud, waste and abuse. As a medical coder, it is your responsibility to prevent fraud, waste and abuse by coding accurately and ethically. Here is how you can help reduce these practices in your daily work. Okay, you have to follow the coding guidelines, you have to use modifiers correctly, you have to stay updated with regulations, you have to report suspected fraud or abuse. Okay, so follow coding guidelines. Always refer to the official coding guidelines for CPT, ICD 10 cm and HECPIX before assigning the codes. Incorrect or careless coding can lead to fraudulent or abuse. Okay, fraud or abuse, it will lead improper coding. Then next, use modifiers correctly. Ensure you understand how and when to use modifiers like modifier 25, 26, 59, 76 and other modifiers to avoid abuse and overbilling. Okay, you should know always when to use modifiers and how to use modifiers correctly. Okay, and stay updated with regulations. Always keep yourself informed about compliance regulations such as this HIPAA and False Claims Act to avoid legal issues related to the fraud. Okay, report suspected fraud or abuse. If you encountered unethical practices, report them to your compliance officer or follow your organization's reporting procedure. Okay, here are some exam tips for fraud, waste and abuse. Okay, so understand the definitions, always look for the clues, use coding guidelines. Okay, and always modifiers usage also matters. So look for the clues, understand the definitions, see, make sure you know the difference between fraud, abuse and waste. So fraud involves intent deception, there is a intention, while abuse is improper practices without intent, and waste results from inefficiency. Okay, this is the difference between fraud, waste, abuse. Fraud involves intention, while abuse is improper practice without intention, and waste results from inefficiency. Okay, look for the clues in scenarios. So in exam, look for specific keywords in the scenarios that indicate fraudulent or abusive behavior. For example, phrases like unnecessary test may indicate abuse or waste. Okay, use coding guidelines always. So if you are unsure about whether something is fraudulent or abusive, check the official guidelines in your coding manuals. Incorrect coding is often the root cause of fraud or abuse, so always make sure to check coding guidelines before you assign anything. Okay, and modifiers also matters always, so know the correct usage of modifiers always. Questions involving improper use of modifiers often test your ability to differentiate between fraud and abuse, so always you should know the correct usage of modifiers. And that brings us to the end of today's session on the fraud, waste and abuse in medical coding. Remember, as a coder, understanding these concepts is vital not only for passing your exam but also for ensuring that you practice ethical and compliant coding in your career. Stay vigilant, follow coding guidelines, and make sure you always act in the best interest of patients and healthcare systems. Thank you for watching this video. If you have any questions, feel free to drop them in the chat box or reach out to me directly. Don't forget to like, share, and subscribe for more CPC exam tips and coding tutorials. Good luck with your exam preparation. And I will see you in next video where we will discuss few practice questions on this topic. Thank you.